Nurse Aide Exam Questions. Question 1. What should a nurse aide do if they experience a needle stick injury? Option A. Wash the area and report it immediately. Option B. Wait to see if symptoms develop. Option C. Apply pressure to the wound. Option D. Ignore it if no blood is visible. The correct answer is option A. Wash the area and report it immediately. Immediate washing reduces bloodborne pathogen transmission risk. Prompt reporting allows post-exposure prophylaxis if indicated. Ignoring any exposure is never acceptable and violates OSHA standards. Question 2. A client with a history of falls has been repositioned. The nurse aide should also ensure. Option A. The bed is in the highest position. Option B. The room is completely dark. Option C. The bed is in the lowest position and the brakes are locked. Option D. The client's family is called. The correct answer is option C. The bed is in the lowest position and the brakes are locked. The bed should be in the lowest position to reduce fall injury risk, and the brakes must be locked. The room should have adequate lighting. Calling the family is not part of the safety routine. Question 3. The nurse aide is caring for a client who speaks a different language. The best approach is to: Option A. Use hand gestures and hope the client understands. Option B. Speak loudly and slowly. Option C. Use a trained medical interpreter. Option D. Ask another client to translate. The correct answer is option C. Use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 4. A client has had a stroke and has left-sided weakness. The nurse aide should: Option A. Place items on the left side to encourage use. Option B. Place items on the right side where the client can reach them. Option C. Ignore the weakness. Option D. Restrain the left arm. The correct answer is option B. Place items on the right side where the client can reach them. Place items within reach on the stronger side to promote independence. Encouraging use of the weaker side is appropriate but should not be forced. Restraining is not appropriate. Question 5. The nurse aide is performing perineal care on a female client. The aide should: Option A. Wipe from front to back. Option B. Wipe from back to front. Option C. Wipe in circular motions. Option D. Wipe in any direction. The correct answer is option A. Wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 6. Normal adult resting heart rate range is: Option A. 40 to 60 beats per minute. Option B. 60 to 100 beats per minute. Option C. 80 to 120 beats per minute. Option D. 100 to 140 beats per minute. The correct answer is option B. 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 7. When a client with dementia is sundowning, becoming agitated at dusk, the nurse aide should: Option A. Keep the environment bright and noisy. Option B. Use a calm, gentle approach and low lighting. Option C. Give the client a sleeping pill. Option D. Ignore the agitation until it passes. The correct answer is option B. Use a calm, gentle approach and low lighting. Sundowning is managed with a calm environment, low lighting, quiet, and a gentle approach reduce agitation. Bright, noisy environments are overstimulating. Sleeping pills require an order and should not be the first response. Question 8. The nurse aide finds a client's oxygen saturation is 88% on a pulse oximeter. The aide should: Option A. Document this as normal. Option B. Report it to the nurse immediately. Option C. Reposition the sensor and wait. Option D. Increase the client's oxygen. The correct answer is option B. Report it to the nurse immediately. Normal SpO2 is 95 to 100%. An 88% reading indicates significant hypoxemia requiring immediate intervention. CNAs cannot adjust oxygen, that is a nursing responsibility. While repositioning the sensor might be attempted briefly, reporting to the nurse is the priority. Question 9. When performing passive ROM exercises, the nurse aide should: Option A. Have the client perform the movement independently. Option B. Move the client's joint through its full range of motion. Option C. Force the joint beyond its range. Option D. Perform ROM exercises only once a week. The correct answer is option B. Move the client's joint through its full range of motion. Passive ROM involves the nurse aide moving the client's joint through its full, pain-free range of motion. The client does not participate actively. Forcing beyond the range can cause injury. Question 10. When removing PPE, which item should be removed first? Option A. Gloves. Option B. Gown. Option C. Mask. Option D. Goggles. The correct answer is option A. Gloves. Gloves are the most contaminated item and should be removed first to avoid contaminating other items. The correct sequence is gloves, goggles/face shield, gown, mask. Question 11. When using a manual blood pressure cuff, the nurse aide should inflate the cuff. Option A. To 100 mmHg. Option B. To 150 mmHg. Option C. To 180 mmHg. Option D. 30 mmHg above the estimated systolic pressure. The correct answer is option D. 30 mmHg above the estimated systolic pressure. The cuff should be inflated approximately 30 mmHg above the estimated systolic pressure, determined by palpating the radial pulse while inflating. This ensures adequate occlusion. Fixed numbers don't account for individual variations and could be insufficient or excessive. Question 12. Which sign indicates a client may need toileting assistance? Option A. Restlessness and picking at the sheets. Option B. Closed eyes and slow breathing. Option C. Smiling and laughing. Option D. Sitting quietly in bed. The correct answer is option A. Restlessness and picking at the sheets. Restlessness or agitation often indicates a need to use the bathroom, especially in clients who cannot verbally express this need. Offer toileting regularly. Question 13. What is the proper ratio of bleach to water for disinfecting surfaces? Option A. 1:1. Option B. 1:10. Option C. 1:100. Option D. 10:1. The correct answer is option B. 1:10. A 1:10 dilution, 1 part bleach to 9 parts water, is the standard for disinfecting surfaces contaminated with blood or body fluids. 1:100 is for general disinfection, not blood/body fluid spills. Question 14. When applying a gait belt, the nurse aide should place it. Option A. Around the client's chest. Option B. Around the client's waist, over clothing. Option C. Around the client's hips, under clothing. Option D. Around the client's neck. The correct answer is option B. Around the client's waist, over clothing. A gait belt should be snugly around the client's waist, over clothing, not bare skin. Not over the chest, restricts breathing, not under clothing, skin irritation, and never around the neck. Question 15. When taking an axillary temperature, the nurse aide should leave the thermometer in place for: Option A. 3 to 5 minutes. Option B. 5 to 8 minutes. Option C. 8 to 10 minutes. Option D. 10 to 12 minutes. The correct answer is option C. 8 to 10 minutes. Axillary temperatures require 8 to 10 minutes to accurately reflect body temperature because the armpit is a peripheral site. 3 to 5 minutes is insufficient. For electronic thermometers, follow manufacturer instructions. Question 16. A client with mental health issues is withdrawn and refuses to speak. The nurse aide should: Option A. Talk to the client regardless of response. Option B. Sit quietly with the client. Option C. Leave the client alone. Option D. Ask personal questions. The correct answer is option B. Sit quietly with the client. Silent presence is therapeutic for withdrawn clients, who may not feel like talking but still benefit from companionship. Talking without response may be perceived as pressure. Personal questions may be intrusive. Question 17. When a client is being discharged, the nurse aide should: Option A. Assist with packing and ensure the client has their belongings. Option B. Tell the client to call if they need help. Option C. Let the client pack alone. Option D. Rush the client to leave. The correct answer is option A. Assist with packing and ensure the client has their belongings. The nurse aide helps ensure the client has all their belongings and assists with packing as needed, promoting a smooth, dignified discharge. Rushing is disrespectful. Question 18. A client with dementia is attempting to leave the facility. The nurse aide should: Option A. Allow the client to leave. Option B. Redirect the client to a safe activity. Option C. Physically restrain the client. Option D. Call security to escort the client out. The correct answer is option B. Redirect the client to a safe activity. Redirecting to a safe activity is the most appropriate intervention. The client may be looking for something familiar. Restraints require an order and are a last resort. Allowing them to leave is unsafe. Question 19. When a client dies, the nurse aide should: Option A. Leave the room immediately. Option B. Provide post-mortem care. Option C. Call the family. Option D. Remove all personal belongings. The correct answer is option B. Provide post-mortem care. Post-mortem care, bathing, positioning, and preparing the body, is the nurse aide's responsibility. Leaving the room is not appropriate. Calling the family is usually done by the nurse. Removing belongings should be done carefully and respectfully. Question 20. A client is angry and yelling. The nurse aide should: Option A. Yell back at the client. Option B. Leave the room and return later. Option C. Listen to the client's concerns and remain calm. Option D. Call security. The correct answer is option C. Listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others. Question 21. Normal adult respiratory rate is: Option A. 8 to 12 breaths per minute. Option B. 12 to 20 breaths per minute. Option C. 16 to 24 breaths per minute. Option D. 20 to 28 breaths per minute. The correct answer is option B. 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 22. A dying client is breathing irregularly. The nurse aide should: Option A. Call the nurse immediately. Option B. Continue to provide comfort care. Option C. Administer oxygen. Option D. Start CPR. The correct answer is option B. Continue to provide comfort care. Irregular breathing, Shane-Stokes, is common in the dying process. Comfort care, including oral care and repositioning, should continue. CPR is not indicated unless the client has a DNR status. Do not resuscitate. Question 23. An adult client with a respiratory rate of 8 breaths per minute is experiencing: Option A. Tachypnea. Option B. Bradypnea. Option C. Normal breathing. Option D. Hyperventilation. The correct answer is option B. Bradypnea. Bradypnea is an abnormally slow respiratory rate below 12 breaths per minute in adults. 8 breaths per minute is significantly below normal. This may indicate respiratory depression, sedation, or neurological impairment and requires reporting. Question 24. Which method of temperature measurement is considered most accurate? Option A. Oral. Option B. Maxillary. Option C. Tympanic. Option D. Rectal. The correct answer is option D, rectal. Rectal temperatures most closely reflect core body temperature and are considered the gold standard. Oral temperatures are affected by eating and drinking. Axillary temperatures are least accurate. Tympanic readings can be affected by earwax and positioning. Question 25. When receiving a report at shift change, the nurse aide should: option A, ask questions about unclear information. Option B, write down everything quickly and leave. Option C, ignore information about client preferences. Option D, rely on the previous aide's verbal report only. The correct answer is option A, ask questions about unclear information. Asking questions ensures accurate communication and safe care. Writing everything down without clarification may lead to errors. Ignoring preferences misses important care details.